The final pilot of the BigMedilytics program is pilot number 12, Radiology Workflows. And coming to us live virtually is Professor Helmut Prosch, is an associate professor of radiology and section chief of the Thoracic Imaging Department of Biomedical Imaging and Image-Guided Therapy at the Medical University of Vienna, and Professor Allan Hanbury, who is the co-founder of ContextFlow and a professor for data intelligence at the Vienna University of Technology in Austria. Take it away.
Thank you very much. So I hope that you see my slides. Good afternoon, or still good morning, everybody. And so I will be presenting the radiology workflows and the objectives of radiology workflows. So essentially, we wanted to bring artificial intelligence support into the hospital to support radiologists. So how to support them? Essentially to reduce the time to diagnosis and also to improve the quality of diagnosis. And the way that this is done is by essentially providing a search engine, a visual search engine for radiology images, for 3D radiology, or for 3D CT images. But my colleague Julie can explain this all much better than I can. So she, in the next video, is going to provide an overview of the concept behind this pilot.
You don't get to be a radiologist without knowing your stuff, obviously. But there are those cases that are incredibly tricky to diagnose, say interstitial lung diseases, or maybe you just want to quickly double check with peer-reviewed literature. When you're uncertain of a finding, what do? Consult another radiologist? Well, what if they're unavailable? You could use a text-based resource, but then maybe you would have to guess the right keyword. And there is always paging Dr. Google. But is this really the best science has to offer? This information search process can be time-consuming, frustrating, and still leave you feeling uncertain. ContextFlow Search is a 3D image-based search engine that's designed to provide case-relevant information within seconds. We enable you to compare any region of your current scan with thousands of other reference patients based on visual disease pattern detection. Colored bars indicate the most frequently cited findings based on the reports of the reference patients. And similarly, heat maps show exactly where an abnormality has been detected. We even provide you the overall percentage of volume affected by a given finding, as well as links to medical literature necessary for differential diagnosis and training purposes. And most importantly, it integrates directly into your PACS. So no more waiting for busy colleagues or guessing the right keyword. Case-relevant information is literally at your fingertips. Go to contextflow.com.
Right, so that was the overview of the concept. So how, in this pilot, we are supporting radiologists. So for the rest of this talk, so I'm going to start with the technical side. So how does the software work? What does the software do? And then I'll hand over to Helmut, and he will talk about the results of the clinical trial that was done as part of the BigMedilytics project. So how does this system work? So I've got another video here that shows the technical concept behind it. So I'm going to start that. So essentially it's a search engine, a visual search engine, so the radiologist can mark an area of interest. And we have a reference database of carefully curated cases for which the diagnosis is known. And selected area gets compared with billions of small cutouts of these to find the most similar image. And then like a search engine, it presents the most similar images. It can present the most similar patterns in those images and the patterns that occur most often. So that gives the radiologist a very good basis on which to come to a decision on the diagnosis and also the differential diagnoses. So in the next video, I'm going to show what the radiologist sees. So how does the radiologist interact with this system? So what's coming up now is, again, the region-based image retrieval. So you can see over there how the radiologist is marking an anomaly, some anomalous region in the image. The system goes back, finds the most similar images from the knowledge base, and also shows at the top the 3 bars that show which patterns occur most often in this image. On the bottom left, it also shows the distribution of the pattern in the lung of interest. So the radiologist can then click on cases from the knowledge base and compare these cases to the case that's under consideration. And compare, then on the right, there is some reference text, so from reference works that give information about the patterns under consideration. So the radiologist can also read about differential diagnoses. What is also possible now is an automated analysis, so that when the radiologist opens the image, immediately the system finds those patterns that are occurring most often and shows them in the bottom left. So even without selecting an area, the radiologist already gets an overview of the patterns, anomalous patterns that are occurring in the lungs, and can then also interact with the search engine as before. And finally, this is not a separate program, so it's one of the things we also did in the project was to integrate this into the PACS. So this is the system that the radiologists use every day. So there's now a ContextFlow button where essentially you click that, and within the PACS you can select the anomaly, and then the ContextFlow window opens up, and the radiologist can then interact with the search engine. So there we have the an overview of the interface. What also, of course, happened during the BigMedilytics project, and the reason that we're sitting here virtually, is the COVID pandemic. And of course, it turns out that there's also a specific type of lung pattern that you see within the lungs that is representative of COVID. So also we came up with a system that searched for these patterns that are representative of COVID and automatically produced a PDF report that was put into the hospital information system. And this allows doctors to very rapidly take a look at an automatically generated report for a patient and decide if there is sufficient indication of COVID or not. So what did BigMedilytics enable us to do? So firstly, through the close interaction with the Medical University of Vienna and the radiology department there, we got a lot of input from radiologists that allowed this artificial intelligence support system to be improved. And also, this system was then integrated into the PACS system at the Medical University of Vienna, so that there is seamless integration into the workflow of the radiologists, like through this button that was shown in the video. And the final thing that was enabled by the BigMedilytics project was a clinical study in which we were trying out, so does this system actually help and support the radiologist? Does it reduce the time to diagnosis, and does it improve the diagnosis? And to tell us about this clinical study, I hand over to Helmut.
Thank you very much. My name is Helmut Prosch. I'm a thoracic radiologist working here at the Medical University of Vienna. You see here our hospital in the center of this picture. And this hospital is one of the largest in Europe. And we see more than 240,000 patients a year and perform more than 370,000 images a year. And all of these images are read by 70 radiologists, and the number of images is increasing every year. So any support from AI to speed up that process, to make the diagnosis better and to come up with more confident diagnosis is certainly welcome. So we were really interested in studying this AI solution, and we did that by performing a reader study. We selected 108 consecutive patients in retrospect, and these studies were read by 4 participants, 4 radiologists. 4 of them were still in training, and 4 are attendings at our department. So each of these participants had to read 27 cases at baseline, meaning without the help of the search engine, and other 27 cases with the use of the search engine. So overall, every reader had to read 54 CT scans. And this made sure that each case was read 4 times by 4 different radiologists, 1 junior and 1 senior at baseline, and 1 junior and senior with the use of the search engine. The task which was given to these radiologists was to come up with a main diagnosis. And the disease group we were investigating are interstitial lung diseases. Interstitial lung diseases are quite a tricky group of diseases. There are more than 200 of these, and the diagnosis is quite complicated. So you cannot expect the radiologist to come up with one diagnosis, which is not possible. But what one expects from a radiologist is to come up with a short list of possible diagnoses, and we call this differential diagnosis. So the radiologists were asked to come up with the most probable diagnosis, and then with alternatives up to 5. We call this differential diagnosis. And then they had to come up also with, they have to state the likelihood of the diagnosis and the confidence of the diagnosis, which is also important, because sometimes you just say, okay, I think it's that, but I'm not that sure. Or in other cases, you say, okay, I'm very sure it's this diagnosis, which makes a difference also in the discussion then with the clinicians. The cases we selected for this study were quite diverse. I mentioned already ILDs, interstitial lung diseases. There's so many of these, but we also included airways diseases and healthy patients. And the study here we performed, this is the study set here I was talking about. This is the baseline where on the left side here, where the radiologists were not able to use this search engine, and they had to come up with a diagnosis, a differential diagnosis. And we also recorded the time it took to come up with a diagnosis. Then the radiologists were introduced into the search engine, and for the next step, they were then able to use the search engine in addition to what they always did. So they could still use their textbooks, they could still use Google, but they never did. So in a sense, they just used then the search engine, because this search engine speeds up the diagnostic process, because it already provides you with specific information related to the case at hand. So the interesting point was, and I did not personally expect that the reading time decreased. So we don't look for information of the cases, so because we are trained radiologists, so in many cases we don't even look for additional information in textbooks or in the internet. But if you have the search engines at your hand, your reading process is sped up, because you are quickly referenced to relative information, and you don't have to think too much and too long about the diagnosis or differential diagnosis. You get specific information about the diagnosis you are about to make. So the overall reading time was reduced by 31%. Interestingly, we just observed a trend towards a higher diagnostic accuracy, but this did not reach statistical significance. For the next step, we have to increase the number, and we are still improving this software as well. So this is not the software which is currently used. This was an earlier version, so we are now already more advanced with the search engine. And the scientific paper is currently under preparation. In case you're interested to learn more about ContextFlow, visit the virtual booth, where you can get more information and can talk with the representatives from the company. Thank you very much. And we hope you have any questions. And if yes, just type them in and we are happy to answer.
Thank you, team. That was great. We'll come back at 12:15 for more information about lunch in the exhibition halls.